Hi, good afternoon. My name is Stephanie Curry, and I'm going to be speaking today regarding a medication that's on the market called Trulicity. Trulicity is on the market to treat those individuals that have been diagnosed with type 2 diabetes. But before I get into talking about Trulicity, I'd like to tell you a little bit about diabetes. Diabetes involves a problem with your pancreas and the pancreas' ability to produce insulin. According to the American Diabetes Association, in a healthy body, the pancreas produces insulin, which then travels through the bloodstream to break down sugars from food. The sugar is then used by the cells in your body as energy. But those folks that have been diagnosed with diabetes, your body can't make enough insulin or it can't use it well. So this results in your blood glucose levels being elevated, or what we commonly call your sugar levels being elevated in your blood and urine. Now, there are two types of diabetes. That's type 1 and type 2. For those individuals that are diagnosed as a type 1 diabetic, they will always need insulin. Insulin is a life-saving medication for those folks because their body can't produce the insulin that it needs to survive. Now, those individuals that have been diagnosed with type 2 diabetes, their body is able to produce some insulin, or it might not do it well enough. But usually, diet and exercise, sometimes alone, can lower your glucose levels, or they might need diet, exercise, and that's where Trulicity comes into play. Now, Trulicity is a medication used to treat type 2 diabetes. It's not insulin. That's very important. You all understand that it's not insulin, but it is a medication that's used with diet and exercise to help control your blood sugar levels. Now, like with any medication, Trulicity does come with side effects. Mild side effects include digestive problems, abdominal pain, decreased appetite, and fatigue. Mild side effects are usually temporary. Usually you see mild side effects right when you initiate a medication. Usually you get that right away. Over time it resolves and you don't have a problem with that anymore. Now, Trulicity comes with what the Food and Drug Administration or the FDA have called a box warning. Now, what that is that when there's a serious side effect, they put that out. And that's for doctors and patients to be aware of. And so with Trulicity, what has happened is that in the testing that they have done on animals, they have found that Trulicity has led to the development of thyroid cancer. Because that's very serious, this FDA warning alerts folks to that fact. So for individuals that themselves have a history of thyroid cancer, or they have a family history, that's also very important, a family history of thyroid cancer, they should not use Trulicity. It is not an option for those folks. Now, Trulicity can be used long term. It has not been used to treat children that are diabetics. You have to be at least 18 years or older for your doctor to prescribe Trulicity. Now, what's a good thing about Trulicity is that you only have to use it once a week. It's not like, other medications where it's every day or twice a day. It's once a day, and it's once a week. And you really don't have to do routine blood tests like you do with some of the other folks where you're sticking your finger to test your blood sugar levels. Usually what they'll do is when they initiate you with Trulicity In about 3 months, they'll do what they call a hemoglobin A1C level, which is just where you'll have a blood draw to see what your levels are. And if the Trulicity is helping with diet and exercise. Now, I do just happen to have a Trulicity pen just to show you what it looks like. It comes 4 in a box, so it's a month's supply. You pick whatever day of the week, the same time on that day of the week, and you administer. It's very simple. You remove this end. It has a lock on there. It's locked. Once you are ready to administer, after you have removed this and you've pressed this against your skin, you turn the lock from the red to the green, and then you push it, and the medication automatically is dispensed. You'll hear 2 clicking sounds. One when it starts, and then you'll hear the second one when it's finished. It's very, very convenient. I've used this with a couple patients at work. I was able to get this because it's expired and we can't use it once it's expired. So they were very nice to give me this so that I can use it for my demonstration today. Like I said, I think this is a very good medication for those folks that have type 2 diabetes. I've seen the patients that we've used it with at work. They've had very good effects from this medication. I'd like to thank you for your time today. Thank you.